Welcome, Cardiology Update viewers and listeners. My name is Shadi Reyes. I'm interventional cardiologist at Detroit Medical Center, Wayne State University in Detroit, Michigan. This year, I'll be hosting a regular podcast and videocast on Cardiology Update. We will have a regular journal club to discuss interesting development in cardiology research news. Today, I will be talking about a recent comments paper published in Nature Review in Cardiology, talking about the environmental sustainability in cardiology and the carbon footprint of catheterization laboratory. In this recent article in Nature Reviews, titled by Environmental Sustainability in Cardiology, Reducing the Carbon Footprint in Cath Lab paper, the investigator kind of highlighted a very important topic that usually as a practicing cardiologist, we don't see that angle. Most of the time, we focus on treating patients, what is the appropriate indication, which procedure the patient needs to have, and also discuss with the patient the risk and benefit of that procedure. Now, the cost of the procedure most of the time is not discussed with the patient because this is becoming an insurance issue or an authorization issue by the governing body of the insurance that treating the patient. However, the cost is one aspect. But what the authors focus in this article specifically on the impact of the waste of disposable equipment used in the electrophysiology cath lab on the environment. And this is very striking data, but yet an eye-opener, but very important to know as practicing cardiologists, especially in the catheterization laboratory. In this article, for example, a single use of medical devices for atrial fibrillation ablation alone create over 125 tons of carbon dioxide daily. You can imagine the impact on the environment of this equipment. And this is not just happening in the US or in Europe or in the other part of the world. This has happened on daily basis in different cath labs, especially in patients with atrial fibrillation, who is a very frequent rhythm issue in cardiology. So in this article also declared that tackling the environmental and sustainability of cardiac catheterization to reduce worldwide emission to net zero by 2050 must become a priority. So how we can do that, how we can decrease that quote unquote waste and impact on the environment. I know our intention to do something good to the patients and treat them. But yet, on the other hand, this angle doesn't come to us as practicing cardiologists is what is the impact of waste on these patients? And I practically myself in the cath lab as well, I don't perform these procedures, but definitely I'm aware of them. As a cath lab director, I'm involved in the cost and purchases of these devices to the people who does the procedure. We don't focus on how much the emission or how much the waste is going to develop. All what we care about, we have the equipment ready for the provider, for the patient who needs it. And oftentimes, we open multiple devices because one doesn't work, so we have to try another one. In the coronary side, for example, we open one catheter to kind of try to engage in the right coronary and it doesn't work. We open another catheter. Sometimes we try 2, 3, 4 catheter in one case only. So this is what the author is pointing out in this article is very important because it highlights the aspect of waste that we are subconsciously not aware of. We know our intention is to treat the patient, but yet it has a major impact. So cardiac cath lab, as you know, is environmentally damaging materials. It's kind of produce that materials. And I don't want you to think of it as a negative way. You have to do your job. We have to treat our patients. But we have to be aware of the consequences. For example, as well, general anesthesia, which offers advances over conscious sedations, occur in 25% of the carbon footprint. And I know in these procedures, atrial fibrillation ablation, it's required most of the time to have a general anesthesia because the patient will require transesophageal echocardiogram. The patient has to be completely sedated to tolerate that procedure. Therefore, the article or the author, I kind of assured in this case, the challenge of decreasing the environmental impact requires innovation and meaningful determination on a global scale. So there is definitely a big kind of it is a big discussion to happen. This is just we are basically scratching the surface of the topic, because personally it never crossed my mind before to think about the impact of the devices. I thought maybe our catheter is kind of a small portion, maybe the cans, for example, for the soft drinks we do, or the disposable and recycling at home that I do on daily basis with my family is enough. But I never thought that this is also impacted and affect my job day to day as well. And this also part of the article, the European Heart Rhythm Association surveyed and revealed a 62% of physicians willing to use more sustainable practices, particularly through the circular economy, meaning you are using kind of recyclable materials. And this is where become as physician, you have to advocate for that cause. We have to advocate for using recyclable material, and we have to work with industry to help develop that recyclable materials, because at the same time we don't want to use same equipment on the same patients that are can cause any infection or harm. But at the same time we have to help the industry and make them aware that this is something significant, and we have to work with them to develop new technology, new catheters, new ablation tools that are recyclable and able to be reused again. It's definitely beyond the scope of this article and beyond the scope of this podcast, but it's definitely something we should be aware of, something we should teach our colleagues about. And maybe this article and others should be replicated in other healthcare domains, for example, surgery and coronary intervention as well. I don't know, for example, myself in the coronary sphere, is what is the waste that we develop on yearly basis or daily basis in our cath lab, or across the United States or Europe, and how much this has an impact on the environment. We don't know that data. Hopefully we'll have it soon from different surveys. So the gist of this article and the authors, what they brought to us, is that recycle is encouraged. And also ablation shouldn't be deprived from any patients. This is no way or mean we are asking the cardiologist or interventional cardiologist or electrophysiologist to stop treating patients. Absolutely not. We're saying do the right thing and for indicated cases, but maybe you have to be vigilant about the impact of waste if we're using certain things. For example, one thing I can think of right now after reading this article and really studying it and personally kind of impacted the way I'm going to be practicing this forward. If the patient, for example, has a study before, an angiogram before, an attempt before from the EP standpoint, and they tried certain catheters, maybe we shouldn't replicate the same thing. Maybe we should save these catheters and skip them and go to something that could work or have a better chance of working in this case. So this way we avoid waste, we avoid reuse, and for sure, and we're shortening the time of the procedure. Most of the times when you are in tertiary care center, usually you get the complex cases, and usually these cases are provided some information about the procedure or the indication for a procedure. So we have to do our diligence in getting full report of what has been done before and also has been attempted before, so we don't replicate the same procedure or same technique and think of something different. Not just go, I will try it again, and if it fails, because I don't want to wait for that report coming from that hospital to wait to try something else. I hope I got my message across clearly, but definitely this is article is an important article to highlight the importance for practitioners like ourselves in the cath lab who use a lot of disposable materials to focus and be vigilant about the impact on the environment. Thank you for joining me, and if you'd like to learn more, please visit cardiology-update.com or follow along on social media. Thank you so much.